My name is Dr. Nancy Kunyiha. I am a consultant physician and diabetologist. I'm currently working at the Aga Khan University Hospital, Nairobi, and I will be here to just speak a little about diabetes in our setup and some of the issues that we are having currently in our country. I think currently we need to know that diabetes is actually a growing epidemic. It's a condition that I think a few years back was considered to be for the rich and for people who are well affording, but currently we know that it is a problem both in developing nations, not just in the developed nations, and that it's affecting everybody and is becoming currently a global issue and a bigger issue in Kenya. We don't have a lot of statistics in all the areas. So there's a lot of undiagnosed diabetes because it is a quiet disease. Many times people present to the hospital mainly when they have symptoms, and that is usually late in the disease. So in some of the areas there are actually data that is existing that shows us we have prevalences of up to 3 to 5% in certain populations. So it's quite high as when you think about a country dealing with the problem of diabetes. Diabetes has two components, so there are different types of diabetes. The one that affects children usually is due to a problem with the pancreas, and that one starts off earlier in life, and children who will then get diabetes at an early age have a problem actually with the cells that produce insulin that are already sick and destroyed. For most of the people, majority of the people who get what we call type 2 diabetes, there is a genetic component to it, but most of it is lifestyle, the way we eat, a lack of exercise, and basically not living very well. Early on in the disease, for many people, you do not get any symptoms. So diabetes can be an asymptomatic disease. As the sugars rise in the body, then you start getting symptoms of maybe fatigue. You may feel a little more tired. Some people get more thirsty. That is a common late symptom. Passing urine more frequently than normal. Losing weight, which is unexplained. So a lot of the symptoms are actually very subtle until you get to the later part of the disease. Why we need to control diabetes is that the long-term complications affect all the organs of the body. It can affect your nerves, it can affect your eyes, the blood vessels in your eyes, and that's why some people get problems with vision, and you can even get blindness. It can affect your kidneys, so that at the end of the disease, if not well managed, you can get renal failure. It can affect the nerves in the feet, so you have problems with sensation and you're not able to feel. So you can get an injury easier and not know that you had an injury. Strokes are also more common in diabetics. The good news is for the complications that many of these can actually be prevented with good control of blood sugars. I can confidently say it's a condition that well managed, you can lead a normal life and live your normal lifespan. But poorly managed will definitely reduce your lifespan. So with good advice on your lifestyle, your exercise, dietary habits, and of course help with your health care provider as far as medications are concerned, well-controlled diabetes is a very manageable condition. I think one of the big challenges is in our setup is that diabetes is costly to manage. So checking blood sugars costs money. Yes. Buying the machines that check the sugars is costly. The insulins and the medications are also costly. So a lot of the challenges actually come about in the treatment. And in Kenya, we still don't have access to healthcare for all the people who need it with the cost that diabetes management requires. The government is doing a lot now, so there are government initiatives countrywide to try and improve the care and also reduce the costing, but it is still a fairly expensive condition to manage for most Kenyans. We have very few specialists in the country who have trained in diabetes itself for the entire population. Most of them are centered, unfortunately, in Nairobi, so that becomes a problem in the other areas outside of Nairobi.
Yes.
We are trying now to equip more nurses and clinical officers so that they are able to at least pick out, know when to refer, and how to adequately manage. So no, we do not yet have adequate personnel, but I think this is currently being thought about,
All right.
and the government is taking initiatives now to train more people.